Hi, my name is Angel, and I'll be talking about the risk factors of cocaine use. Child trauma such as sexual, emotional, and physical abuse relates highly to female substance abuse problems. Females tend to be more impulsive than their male counterparts. This causes risk factors between gender and crack cocaine dependence. Traits negative, emotionally inclined, a tendency toward mood disturbances, as well as reactions to stress, alienation, and aggression is related to substance abuse. Some preventative methods would be several programs for women who have demonstrated consistent and positive vintage when implemented completely and with fidelity. School programs such as Athena, which is a gender-specific program for female high school athletes, found to increase the knowledge of drug consequences. A lot of athletes use Athena as one of those programs, like as repeated for school programs, and to help them as far as increased knowledge of drug consequences. The Strengthening Families Program, SFP, is an evidence-based family skills training program found to significantly improve parenting skills and family relationships, reduce problem behaviors, delinquency, and alcohol and drug abuse in children, and to improve social competitiveness and school performances. Child maltreatment also decreases as parents strengthen bonds with their children and learn more effective parenting skills seem to be more effective for females than males because girls are more influenced by family members. Here is a video of how effective cocaine can be to your body.
I'm on the pursuit of happiness, and I know everything is shining, all is gonna be gold. I'll be fine once I get it.
Addiction is when habitual drug use is continued despite adverse effects, and despite repeated efforts to stop. Addicts are habitual drug users, but not all habitual drug users are addicts. Addiction usually leads to negative effects on family, work, and social life. So specifically, we're going to talk about cocaine. Cocaine is made from the leaves of the cocoa shrub, which grows in the mountainous regions of South America, in countries such as Bolivia, Colombia, and Peru. In Britain and America, the most common form of cocaine is as a white crystalline powder. Most users snort through the nose, but it is also sometimes made into a solution and injected.
Here are some of the short-term effects of cocaine.
I'm addicted to you, hooked on your love, like a powerful drug. I can't get enough. I'm in love with the coco. I'm in love with the coco. I got it for the Lolo. I'm in love with the coco. I'm in love with the coco. I'm in love with the coco. I got it for the Lolo. Turn up. I'm in love with the coco. Hit my plug, that's my cholo. Cause he got it for the Lolo. If you snitching, I go loco. Hit you with that 38. Niggas thinking that I'm solo.
Dopamine is a neurotransmitter released by neurons when you experience a pleasurable stimulus, like eating chocolate. The dopamine system is the pathway that dopamine takes in the brain. This starts from the ventral tegmental area where the dopamine is made by dopaminergic neurons, and the dopamine is sent to the nucleus accumbens and the frontal cortex. Normally, in the synapse, dopamine is released by exocytosis to the postsynaptic dopamine receptors, which cause excitation of the next neuron. Then, to end the stimulus, dopamine is taken back up by the presynaptic neuron through dopamine transporters, called DTA. Then, when someone takes cocaine, dopamine is released into the synapse and cannot be taken back up. This causes hyperpolarization and the feeling of euphoria. After significant amounts of a drug have been in the body for a period of time, its sudden elimination can trigger physiological reactions called withdrawal symptoms.
Come to decide that the things that I tried were in my life just to get high on. When I sit alone, come get a little known, but I need more than myself this time. Step from the road to the sea to the sky, and I do believe that we rely on. When I lay it on, come get the bread on for my life to sacrifice. Hey, oh, listen what I say, oh, I got your hey, oh.
Cocaine produces a sense of extreme joy by causing the brain to release higher than normal amounts of some biochemicals. However, cocaine's effects on other parts of the body can be very serious or even deadly. When cocaine use is stopped or when a binge ends, a crash follows almost immediately. The cocaine user has a strong craving for more cocaine during the crash.
Listen what I say, oh, come back and say, oh.
Some of these are female testimonies. Some of these are female testimonials on cocaine use. The study used qualitative interviews conducted with 19 women who are former cocaine users, used to explore their experience of stress and their views regarding the relationship between stress and drug use. As Tony pointed out, what keeps a person out there using crack is the chaos, the frustration, and the stress. According to the study, participants, crack was used to numb or turn off the feelings of pain, anxiety, and despair they could not bear to feel. It was used to escape from difficult realities and run from distressing thoughts and feelings and medicate emotional pain. So basically, these people were using crack cocaine as like a lead way or an escape from reality, which is what normal people normally use those drugs for, like an escape, just in the moment type of situation. And when the high is over, they're gonna feel how they feel before they got high. Cocaine affects you mentally, physically, and emotionally. Here is some of the facts of cocaine that affects women. Women often use substances differently than men, such as using smaller amounts of certain drugs for less time before they become addicted. Women are responding to substances differently. For example, they may have more drug cravings and may be more likely to relapse after treatment. Sex hormones can make women more sensitive than men to the effect of some drugs. Women who use drugs may also experience more physical effects on their heart and blood vessels. Brain changes in women who use drugs can be different from those in men. Women may be more likely to go to the emergency room or die from overdose or other effects of certain substances. Women who are victims of domestic violence are at increased risk of substance use. Divorce, loss of child custody, or the death of partner or child can trigger women's substance use or other mental disorders. Women who use certain substances may be more likely to have panic attacks, anxiety, or depression. Some women use substance while pregnant or breastfeeding. Substance use during pregnancy can be risky to the woman's health and that of her child in both the short term and long term. Most drugs, including opioids and stimulants, could potentially harm an unborn baby. Use of some substance can increase the risk of miscarriage and can cause migraine, seizures, or high blood pressure in the mother, which may affect her fetus. In addition, the risk of stillbirth is 2 to 3 times greater in women who smoke tobacco or marijuana, take prescription pain relievers, or use illegal drugs during pregnancy. Pregnant women should check with their health care provider before using any medicines or substances. Some preventative levels are tertiary drug prevention programs. Drug prevention programs focus on interventions and targeting chemically dependent individuals who need treatment. Examples of tertiary prevention include assessment and diagnosis, referral into treatment programs, case management, and reentry. Substance abuse programs strive to help stop the destructive cycle of drug use and drug-seeking behaviors, along with the damaging effects that go on hand with continued use and abuse. And those are just some fun facts about crack cocaine use.